What's he doing? What's on my head? Hanging testicles. Practice on those for cat neuterings.
Today is Thursday. We had 2 students with us. One is trying to get into vet school. The other one is just going into his 2nd year of vet school. So we've had lots of help and lots of teaching opportunities. Yeah, and then so when you grab your other one now, you can be a little bit more messy with it, but then still try to keep, like, don't let these fingers touch this hand. I like teaching, except for the fact that I'm like, am I teaching them wrong? Am I doing it wrong? But yeah, I like teaching. I like talking.
I did my undergrad at the U of A, animal science degree, and then I think it was in my 2nd or my 3rd year actually, there was this animal science mini internship type things. So I applied and I just saw a beef veterinarian. I didn't know anything about Cody's previous clinic or who Cody was. I just knew that I had an interest in large animals. He'll say that he made me believe in myself to chase my dreams, and it's just been special.
My name is Vlad, not...
I'm very privileged, and I realize that, and I take advantage of it also to make it work for myself and get the experience that I need to hopefully one day go as close as I can to what Cody's doing. He just showed me that there is a way of doing things and there is a way of becoming successful. You just have to be your own person and be unique and go against the grain.
No, but look at these. Look at.
No, this is better.
No, it's not.
This is better.
How is it better?
It's just better.
That's a big testicle. I was born in 1997 in Edmonton, so born and raised Edmontonian, and then we moved out to the farm in 2015, 2016. My parents, coming from former Yugoslavia, they grew up on villages and small towns and raising the food that they eat, whether it be the gardens, whether it be the meat, going to farmers markets back home and selling the products. So I was just introduced to it at a really young age, and thankful to my parents, to my grandparents for introducing that to me, because I don't know what I would do at this point without agriculture. So I just want to give back in a sense with my services through veterinary medicine. Currently, as it stands, I see myself more in a large animal mix type of role, but then again, it might change, and then hopefully, I mean, with Fen Vet now in the picture, we might be able to work something out and just go along that process of expanding its name and expanding what its mission is and reimagining vet med.
We started the morning out looking at a dog that actually surprisingly had 3 incidental bullet shots that we found on x-ray. The dog had presented for swallowing weird. The owner was a little bit concerned that something was stuck in its esophagus or in the trachea, but there was nothing that was visible on oral exam or on x-ray. Incidental finding was that this dog has a couple little BB gun pellets under its skin. She was rescued at 1 year old. So they're just there. They'll probably be there forever. We just leave them alone. It's something that we see every once in a while. Next, we moved on to a dog neuter. Pretty routine. I feel like I talk about dog neuters every single week, but this was a 2-year-old male intact Frenchie. Owners just waited a little bit longer to get him neutered. It was pretty straightforward. We were able to get Vlad to scrub in and help us out a little bit with it. So on a neuter, you just do 2. On a dog spay, you're gonna do 3 layers. So I'm gonna close the sub-Q, and then I'm going to close the skin. And everything should be hidden, so nothing will have to be removed afterwards. Just making sure that things aren't gushing too much. I might even just tie that one more time. Just bleeding from, like, not enough to worry about. Like, I feel like when you first start, you're really scared of blood.
Yeah.
And like things can bleed a little bit.
So you just do a continuous pattern?
Yep. And then we'll do a continuous pattern back.
So when it comes to hair regrowing back, when it's being sutured like that, like what are the chances of ingrown?
I don't know, I don't see any.
Yeah.
Like, or at least any that like bug the dog at least.
So they're not as sensitive as humans.
No. I think that's just like a general thing. Animals just really don't seem to be as sensitive as humans for anything.
Fair enough.
Well, I grew up on a farm just outside of Bashaw in central Alberta. And so we had beef cattle. I've always known that I wanted to be involved in agriculture. And one time when I was 12, I watched a C-section on one of our cows, and I was like, this is So cool. So ever since then, I've been like pretty interested in vet med. Right now I'm just in school at the U of C studying physics, trying to get into vet school. It's important to spend some time in a clinic. And every time I do come, it's so affirming. I'm like, wow, this is awesome. Like, this is where I want to be one day. Why I'm shadowing Carling specifically is because I think a couple of years ago, a friend was like, hey, you should follow this girl on Instagram. She's pretty cool. She's from Ponoka. Her social media feed was pretty sick. So I was like, this looks awesome. Shadowed her in Ponoka. And then when she moved here, this is my first time hanging out with her in Airdrie.
I'll use Cody so that I can show you at the same time. Okay. Use the clean. So use this guy.
You wrap first like this.
Yeah, so wrap
and then
around.
Scoop. And then scoop like that.
Yeah.
And then I unclamp.
Yeah, and then you would unclamp.
She doesn't put me way below her because I'm just some girl trying to get into vet school one day. Like, she's always walking me through exactly what she's doing and making sure that it kind of makes sense to me, which I find is like really valuable to me because it's like helping with that affirmation of like, yeah, this is where I want to be.
Cody had some really cute puppies in that he got to deal with. The one had an infected eye and a small little abscess that he was pretty excited about cutting open. I think he misses his cow vet days where he had a lot more abscesses to deal with.
We should clean the milk off its leg and then we can tell if there's anything a different color.
Oh, so
There's a
satisfying.
little baby abscess. We better do another saline flush. Now that we're loosening up all the goobers. 100% a litter mate bite. So just like humans can get infected from animal bites, animals can get infected too. So yeah, those little teeth and little claws are very, very sharp. Bacteria gets into the skin and that's what causes the abscess. This pup came in already once with a swollen leg. This leg actually, that was abscessed. So we got that fixed up and that part looks amazing, but now we're back with another little toe abscess. The flush just wasn't quite doing what it needed to do. So I just wanted to curette or debride the wound. Now some people call it debride the wound. So that's just physically remove damaged material. Typically we would want to do a full sedation, but we very much hesitate to do a sedation in little puppies. They are very risky. So I did freeze the area. We're just uncomfortable because we're being held, but we do need to scrape out or flush out as much junk as we can because all that material has bacteria in it. There's no amount of antibiotics in the world that could ever penetrate in that much. That is quite the pocket, little guy. We got everything out. Oh yes, I know, sweetie. So now we're just cleaning it with a little bit of antiseptic solution to kill the remaining bacteria. Much better.
That looks better.
Oh my god, I'm just falling apart.
So that's
Okay.
where it was swollen.
Okay.
So it's got some cream on it now.
Okay.
It's gonna be draining. You still have some antibiotics
Yeah.
left, so just go back on antibiotics.
Okay.
Then we moved on to a cat neuter. We had a little bit of fun trying to show the students how we actually proceed with the surgery. So we do the rubber boot technique. Shove it in the rubber boot and just rip. I'm kidding. That was a joke.
Well, Gordy's
I don't know what the rubber boot technique
No?
was. No.
Oh, it's a farmer technique. So they like trap the tomcat, shove it in a rubber boot so it's like stuck, and then they cut the testicles and just rip them out like a calf.
Oh, so it can't move around.
Yeah. We
I'll put that one in my notes.
Yeah, don't save that one.
It sounds legit. When you're from Serbia, it's legit.
Hey, don't insult us like that.
I made a little prop to make it look like we had a spermatic cord and a testicle, and I showed them how to do it. It's mostly that I want to make better ones than Cody because he's trying to make some right now too.
So it's not dedication, it's competition.
It's funny because a couple months ago I didn't think I was a competitive person. I think maybe this will work. Okay. So, testicles.
Those are my victims.
Those are your victims.
Yeah.
Don't pop Cody's balloon.
You ever see this video before? Come watch this one.
No!
Whoa, he doesn't even make an incision?
It's a Burdizo. So they just crush the spermatic cord.
I mean, it makes sense, but why?
Because you always got your teeth with you.
And then this is the figure 8 method, so you're gonna wrap around.
Okay,
You're gonna go underneath.
okay,
Then you're gonna clamp like this.
okay.
And then you would cut. And then you pull this over and it creates a knot. And then that drops back into the,
Where
without
would
the
you-
testicle. And so when you cut, you would cut at where this knot is.
Okay.
And then you push this over. And that's what would drop, oh sorry, that's what would drop back in.
Very cool.
So that's it. Super easy. Yep, now you're good to like fix them however you need to fix them. And you have to put like quite a bit of pressure so it's out now. I'll show you how to do this one and then you'll do this next one. So then, like don't use all your strength, but use quite a bit of it.
Just to scrape off the tissue.
Just, yeah, scrape it off. I always have to use a tissue.
Yeah.
And then usually there's like a second pop almost that happens. Otherwise, there's a lot of tension for the figure 8. And sometimes I find even on small cats, I'll switch to the other one just because I can't get it. Like, the elastic band is nice.
It's stretchy.
Yeah, it's stretchy, but so then it's clamped, testicles there, we
Yep.
got our thing done. And then so the knot's there.
Wow.
And then just drops back in. Easy peasy. Same thing as what I did though. You're gonna,
Okay. So now at this point is where you have to slide the tissue.
yep. So you have to be like more aggressive than what you think,
Okay.
but also don't rip the testicle off. It's honestly like way harder than you think it's going to be, hey? Like
Oh.
vets make it look so easy and then that's it. Yeah.
Sweet.
Cat neuter, done.
Awesome. Thank you.
You're welcome. Britton will make it look like it all happened.
Just
Just like that.
if you don't know how to edit it, I'll edit it.
Then we saw a dog that had a eye ulcer. It was a 1-year-old intact female Maltese dog that presented just earlier this week for having or scratching a lot at its face. The owners noticed that the eye progressively got more swollen and red, and it got to the point where it really was super irritated to the pets.
Oh, she is so itchy. Yeah, she really is. It almost looks like maybe she had like a contact sensitivity to something. Like maybe she came in contact with something on her eyes that are bothering her. Obviously, I want to do a full exam first, but it does look very irritated on the outside. So what I'm going to do is, just because I need to take her to a dark room to be able to look at her eye, I'm going to bore her to the back. We're going to take a look in both those eyes. I'm going to stain them with a fluorescent dye to make sure that there's no scratches on them. And then we'll make a plan from there. Okay?
We stained the eye, had a really good look, and did a bunch of special tests on it.
We're gonna make sure that her pupillary light response is working.
So just making sure that her pupils are getting small when the light comes on them.
Mm-hmm. Okay.
So then we're gonna use this little stain, and we're gonna stain the eye to make sure that there's no,
Is this the cool part?
no ulcers on it. So this is, or no like scrapes on the eye. Oh, sorry. And then we're gonna change this to a blue light. And then the stain fluoresces in the blue light. The cornea, the membrane on the top of our eyes is disrupted at all, then the stain will stick to it. Otherwise it shouldn't stick to it.
Just wipe off.
Yeah. So you'll see the fluorescent area in the middle of the eye.
Ooh.
See that? Like, it's on the lateral side, the lateral bottom.
Yeah.
That's the ulcer. So the stain sticks to where the defect is. And then that means that the rest of her eye is probably just irritated from her rubbing it so much. Now we'll just clean up her eye. We will bring her back to the owners. She's has a little bit of a yellow face now from the stain. happens usually is they'll scratch their eye, it'll get infected, and then it just starts getting bigger.
Right.
It's not terrible at this point.
Okay.
So hopefully it's a pretty simple corneal ulcer, and we can treat it with some antibiotic drops and some pain medication, and we should see resolution in about 10 days to 2 weeks.
Okay.
Okay, so I'm gonna get her some antibiotic drops.
Okay.
I want to get her something that'll provide her some eye comfort. It's called atropine drops. We'll have to get her to stop itching her face, so we'll have to give her a little cone. And then I'm just going to get her an anti-inflammatory pain medication that'll help everywhere and everything, especially with how irritated the surrounding area around her eyes. So if at any point it does seem like it's getting worse, bring her back in, okay? Because then we'll want to maybe change up our treatment a little bit.
Right. Okay.
Okay?
Hey, wee girl. Thank you
All right,
so much.
you're very welcome. Let us know if things are not improving at all. And,
Okay.
but we should see some improvement in the next couple days.
Yeah. One of them will let you know.
Okay,
For sure.
sounds very good. It was nice to meet you.
Nice meeting you also.
I highly recommend anybody who's thinking about going to a clinic or just shadowing a vet. There's a lot of great people within the industry right now that are more than willing to show people the ropes and what it's all about, and you learn so much at the exact same time, so it's just beneficial. It's a win-win situation if you ask me. That's my biggest thing from today. We'll see what it's like when it comes to the fatigue and stuff of doing it day in and day out, so I'm sure the old timers here, if I can say that, they might do things a little bit faster and stuff because they've done it for so many years, but just to be there and witness it for the first time is something special. And I know a lot of people within veterinary medicine kind of get discouraged right now because A, it's a lot of schooling, B, the pay isn't great coming out of school, and C, it's a ton of work. But just coming here and seeing it, in my eyes, it makes it worthwhile.
Every time I am in a vet clinic hanging out and I get to enjoy some cool experiences, I'm just like, wow, this is so good. It's like, yeah, this is why I'm doing this. Like, I want to be here one day.